What to do when you start doing ozone therapy and the sensation of air hunger or the symptom of not being able to breathe, of not getting air into your lungs starts getting worse. So this is what I want to talk about in this video. So there is a group of people who start receiving ozone treatments, and this symptom that is often described as air hunger. So this is the sensation of basically not being able to breathe, and it's like the sensation, and it's extremely disconcerting. It's really frightening of basically not being able to breathe. And I used to have this, so I know how bad this is, how bad it can get. So some people, when they start doing ozone therapy, this sensation starts getting worse. And some people, they think that this is because they're feeling their Babesia infection. And so here I want to talk about what to do when this happens. So first of all, what needs to be known more is the fact that this sensation of air hunger, of breathing difficulties, can be caused also by other things other than Babesia. So just because someone is suffering from air hunger does not automatically mean that they have Babesia. Even if they have Lyme disease, even if they were tested positive for other Lyme co-infections, that still does not necessarily mean that it is Babesia that is triggering the symptom. So it can be, but it doesn't have to be. This is not the only explanation. So first of all. Second of all, if it is Babesia, so ozone is certainly not making the infection worse. And I will give you 3 very good reasons why this is absolutely not the case. Number 1 is because we have a number of members in this group who were tested positive for Babesia, started doing ozone therapy, and they recovered. They either completely recovered or their symptoms got significantly better. So one and the same thing, namely ozone therapy, it cannot eradicate an infection in one person and then feed the infection in another person. This doesn't make sense. It would be like saying that antibiotics are able to kill bacteria in one person but make the same bacteria flourish in another person. It just makes no sense. So this really needs to, people really need to put this out of their heads. And it's really unfortunate that this idea is being kept alive, and I believe that in most cases it is being kept alive by alternative practitioners who are just not thinking the thing through. Number 2 reason why it cannot be that Babesia infections are getting worse through ozone therapy is because ozone cannot feed any organism. So there's no known organism that will actually grow bigger or grow in numbers when you supply it with ozone. So ozone cannot be used as food by any known organism. Number 3 reason why it is not possible that Babesia critters, Babesia bugs will multiply when you do ozone therapy, that is the fact that oxygen is given freely to people in hospitals. So, and without those people being tested what type of infection they have. Because the argument behind the idea that ozone therapy could feed Babesia is because Babesia is an aerobic organism, so the argument goes that it will feed on ozone, which is a type of oxygen. And no, this is not how it works. So if that was the case, then hospitals, before hospitals would give oxygen to their patients, they would first either do a swab and then run a culture to determine what type of infection they have, whether it's an aerobic or anaerobic infection, and only then would they give them oxygen to breathe if they need it. But this is not the case. No one does this. If someone feels bad, if their oxygen saturation falls, then they're immediately given oxygen. No one is looking whether that person is suffering from aerobic bacteria because, God forbid, breathing more oxygen could feed the bacteria. No, this is not in accordance with reality. Something like this is not taking place. On the contrary, we observe that when people are exposed, when bacteria is exposed to hyperbaric oxygen, so increased amounts of oxygen, and even if the bacteria is aerobic, the too much of the oxygen will actually kill even aerobic bacteria. So this idea that, okay, bacteria is aerobic, so it will thrive on ozone therapy and on oxygen therapy, and hence the infections will get worse, is just completely fallacious. So people really need to just completely forget about this. But still, it is a reality that some people have Babesia and other tick-borne diseases, and they start doing ozone therapy and they start getting worse, and especially they start developing this symptom. Well, the symptom starts getting worse, that symptom of air hunger. So how can this be explained? Well, as I said, first of all, one needs to recognize that this symptom of air hunger is not specific to Babesia. Other things can cause this, and other things which are as good as never talked about in the ozone community, those are all symptoms of cervical instabilities. So what is the connection between cervical instabilities, air hunger, and ozone therapy? So we know that certain cervical instabilities, for example, things like craniocervical instability, so the instability between the skull and the top vertebra, or atlantoaxial instability, so the instability of the top vertebra, the atlas, or things like bulging discs. Bulging discs can also, when they occur in the cervical spine, they can also cause instabilities. Or ligament laxity, so people who have conditions like Ehlers-Danlos or other connective tissue disorders, they can also develop cervical instabilities. Okay, so how can cervical instabilities cause the symptom of air hunger? Because the part of the brain which controls our breathing sits here at the bottom of our brain, at the bottom of our skull. So when there's an instability, there can be an impingement on that region that controls breathing, and this can trigger symptoms like air hunger or the sensation that one cannot get enough air. And so often, even when the lungs are perfectly healthy, there's nothing wrong in the respiratory area, and people still experience this distress that has to do with breathing. This can be an indication that the problem sits here in the neck, and it has nothing to do with lungs, or it may not even have to do anything with an infection. So this is one thing, one area to explore. So if you have that symptom, you should be also thinking about getting an MRI done and consulting neurosurgeons and consulting other specialists to exclude that possibility that there could be something going on with your neck. Another possibility is, for example, the occurrence of intracranial hypertension. So if you have, for example, bulging discs in your cervical spine, this can block the flow of spinal fluid, because our brain and our spinal cord is surrounded by spinal fluid, and this fluid is being constantly produced by our body, and it's constantly being transported away. So it's a constant flux of this fluid. And so if this fluid is somehow interrupted by, for example, bulging discs, then there can be pressure buildup, and this can cause something called intracranial hypertension. And this pressure can exert pressure on exactly that part of your brain that controls the breathing. So this is another possibility, another possible explanation why, if you have this symptom, why this has not necessarily to do with your infection. But it could have to do with your infection. And so here's why. Because We know that things like tuberculosis, we know that things like brucellosis, we know that things like certain respiratory infections can cause the subluxation of the top vertebra in kids. Respiratory infections can cause a movement of the top vertebra in children. And we know that tuberculosis and brucellosis can cause cervical instabilities. One such case this is such a well-established thing, and this is something that has been observed and documented by medicine for such a long time that it's even made its way to popular culture. So when you watch one of Sergio Leone's movies, I believe it was the Once Upon a Time in the West, there was the villain. There was a businessman who was always traveling in a train cart, and he had a stiff neck brace that he was always wearing. And there's one scene where he explains that the reason why this is because he used to suffer from tuberculosis, and those cervical problems were a result of this. And that film was shot, I believe, in the 1960s. So already that far back, 60 years ago, we knew that tuberculosis or a bacterial infection can cause cervical instability. So again, this is something medically well documented. This is not some fringe theory, okay? And the same thing is true for brucellosis, another bacterial infection. So the same thing could be true for Babesia, for Bartonella, for Lyme, and for other infections. Only that this hasn't been studied yet, because as far as I know, there are no funds being made available for this. So it's absolutely possible that cervical instabilities are a late stage symptom of tick-borne diseases. And so the question is, but how is it possible that ozone therapy could make this worse? How could ozone therapy make a cervical instability worse? Well, if the cervical instability is because of some form of infection, then this could be a detox reaction. It's possible. Another speculation of mine, that's, as far as I know, only I have come up with this idea. So again, there's absolutely no research on this. It's just the thoughts of the crazy ozone lady, is that ozone therapy could be displacing oxalates. So those are tiny crystals which are contained in all plant foods and that we take in through foods, and that are being deposited in our bodies, and especially in our joints, and they impact the health of our joints a great deal. So it's possible that when people start doing ozone therapy, those oxalates are displaced, and that those tiny amounts of crystals that are being moved around, that there are enough to cause tiny micro instabilities, and that this again has an effect on the part of the brain that controls the breathing, and so symptoms like air hunger can be triggered. So this is another possibility. Yet another speculation theory of mine is that ozone therapy could also help with the spinal fluid circulation. So if there is a pressure buildup, as I described before, because, for example, of bulging discs, so if the spinal fluid cannot be transported away properly, if the circulation is somehow impaired, then it's possible that ozone therapy will actually improve that, and that the hypertension will fall. And when that happens, then a whole range of neurological symptoms can set in. So we do know from people who actually go from hyper to hypotension inside their brain that they can develop things like dizziness, like nausea, like headaches. And it is assumed this is all because of the effect of the pressure of the spinal fluids towards that region in the brain. So those are speculations, those are possibilities, but the key point to take away is that if you have that symptom of air hunger, then also look beyond infections. And as I said, yes, it may be that infection, Babesia, Bartonella, Lyme, that this was your primary problem, but it's possible that now you're dealing with a late stage symptoms which have moved beyond the infection, and that your problem has become a structural problem. And so this is something to look into, and this is something that is rarely discussed, but I think more people should look into it, also taking into account that a certain group of people at the Phoenix Forum that is dealing only with people who suffer from chronic fatigue, that a recent poll found out that between 75 and 80% of people who suffer from chronic fatigue syndrome have been diagnosed with atlantoaxial or craniocervical instability, or like either or. So it appears that especially for people who suffer from chronic fatigue, that those types of cervical instabilities may play a much more prevalent role than commonly is accepted. So those are the thoughts of the crazy ozone lady. Keep in mind, this is not medical advice. Always listen to the WHO and the CDC. If you're sick, go see a doctor. Don't listen to crazy ozone ladies. Thank you very much for listening, and see you in the next video.